Well, welcome back. I am Dr. Melissa Cady, joined by Dr. Kevin Cuccaro here on the Paindora Podcast. And we have been diving into all kinds of things that are current, including our pandemic or COVID-19 pandemic that we've all been focused on, and it just can't get out of our news feeds and our ears and our eyes. But we're going to tap into a few things to start off with that we left off last time, discussing just the impact that this pandemic of COVID-19 could have on our children. And I know for some of us, we think that, my goodness, sometimes we're not used to maybe teaching our kids. Maybe we have to homeschool a little bit and remind ourselves of the things that we've forgotten a long time ago. Or it's an opportunity to just really, bond with your children, even if you're stumbling through it, and have the chance to just really enhance our relationships with our own family. And there's also a lot more opportunity. I think there's a silver lining, as hard as it is to see right now. I think on the other side, we'll recognize that there was some enlightenment that comes with this pandemic. Any thoughts on that, Dr. Kevin?
Well, I mean, there's definitely going to be some things coming out of this, good and bad, but it is remarkable on what is going to reveal over the next few months, right? Yeah. So when you're looking at, you're talking about kids, and so we originally were going to talk about a little bit about education, and I want to hit that for sure. But I also started thinking about some of the other implications with this, because depending on the family structure, what your family's like, this could be an incredibly stressful event as well. So then we're starting to look at what are the long-term effects of this kind of trauma. We can almost look at, this is an acute trauma in certain families. Now, I have 2 kids. Luckily, it has not been, I would say, traumatic in any way, shape, or form, other than them whining about homework or something sometimes. But yeah, I mean, this has changed a generation. In fact, I was reading, I think it was a New York Times article this morning, that someone was discussing with a colleague of theirs, and I don't remember if they were an epidemiologist or they're medical or whatever, but really what the future impact is going to be on how a new generation of people is going to live. In fact, they said, well, we just started to call them Generation C, like Generation COVID, right? And it's true. So what we know with the way this virus is sort of playing out right now, granted, we're only a month in, at least in the United States at this time, but it's going to shift the social dynamics heavily for, at a minimum, I'm thinking between 12 and 18 months. So that's going to change schooling. That's going to change social practices. It's going to change athletics. For kids that are going to college, it's going to change how is that going to play out? Because already, as kids have returned home from college, colleges are now delivering their classes online. So that's going to be a hard sell to say, granted, I know people want to go on campus, but that's going to be a hard sell to say, well, you have to go on campus in the future now that we've demonstrated that you can't. And so that may make a difference, because now you're not having to pay room and board. Maybe, my kids are in Oregon, and if they want to go to, I don't know, somewhere on the East Coast, well, why can't they live in Oregon and pay cheaper rent somewhere and attend a university someplace else if you can do it virtually? So, yeah, it's going to be really, really, really interesting on the physical side, the mental health side, the social side, the educational side. Lots of change coming.
Yeah, no, I think that there's definitely, this is a generation. I think it's going to impact all generations, but I think it's going to, of course, mold the youngest generation in a way that a lot of us have not had the same kind of concerns, fears, or beliefs that are being shifted throughout the course of all of this. But I do think that, that you hear these comments about not having, the kids in school, and we kind of tapped into that, but just this idea that there is a lot of opportunity amid the stress. Granted, there are people that are able to still work. There's definitely a percentage of our population that either, whether they're in healthcare or not, they're going to feel the impact in some way. But there are still some people that might be paid by the government or have, they're retired and they're still getting their checks. Assuming that'll keep happening, that they're not going to be an alarming situation with that. But if there are parents that have children at home, that there's an opportunity to see just seeing the opportunity versus the fear and concerns and stress that are innate with all of us there to some extent if we're not working. But you can find an opportunity to teach your children a lot of different things that are, as many of us have recognized, despite the fact I have no children, I hear it from friends of mine, there are a lot of things that children do not learn that is so valuable for our life, and even from physical activity, creating that physical activity and movement for your children, whether it's inside or outside, whatever's safest, or creating, doing projects together or teaching them how to do things around the house or fixing the car or, the things that you feel like you never had time with, digging into those things you felt like you wish you could have done or have time to do with your children, not just bonding with them, but hopefully not just getting on each other's nerves, but finding ways to have fun together, versus just like chores that might seem not so bonding, so to speak. But
well, you're talking about things like even home ec, like teaching kids to cook. Like I can't think of, it's just remarkable to me that kids don't know how to cook. And how are you supposed to go out in the world and if you don't know how to prepare food, and then you don't know how to prepare food, and then all the restaurants go down. So it's like, what are you supposed to do? So yeah, there's definitely some opportunities now for that. I do think if you have young kids, this would be extraordinarily difficult, and especially if you're working at home, because that was rough. My kids are older. They're 14 and 17, so they're pretty self-sufficient and self-directed and all that stuff. But man, when they're 2, 3, 4, 5, 6, that's a different story. And actually, from friends that have homeschooled their kids, that actually takes a little bit more work. But the funny thing is, when you're looking at education, is how inefficient it is. Like in the traditional school setting where they're going to school for 6 or 7 or 8 hours or whatever, the actual learning that any individual kid is doing is not 6 or 7 or 8 hours. It's probably closer to maybe 2 if you're lucky, given all the stuff running around and dynamics and stuff like that. So on the flip end of that is if you have a good curriculum, granted when your kids are younger, there's no more hand holding. You have to kind of direct them and sit with them through the process. But you don't have to sit there 6 to 10 hours. You may be able to get down the exact same course load or more within 2 to 4 hours for someone who's in elementary school. And as they move up, again, our friends who've homeschooled have said that it gets less and less as a parent. So while they're in middle school, it's maybe 2 hours or whatever, and just help them with homework. And when they're in high school, they're pretty much self-regulating. So again, I feel for the people who have the really young kids, because I feel for them anyway, because that's just tough. Little kids like that is hard. But if once we start getting settled into this and starts to make sense again, I think they're going to do. I think people will be pleasantly surprised, like when they find out that their kids can learn everything that they were learning in school in 2 to 3 to 4 hours, maybe. That provides them more time to do other things as well. So.
Right. And I think, there are things that you have to learn to do the test. We could have a whole other conversation on whether college is necessary, and that's depending what kind of person you're talking about. I mean, there are some entrepreneurial minded type of individuals that can create businesses and ideas and run with it, and they don't need the structure, and they can create their own and are okay with falling on their face multiple times and get back up. But there's other things that are not going to ever really be tested in the typical school curriculum. So I think what's really interesting, and this is just my opinion, is that I think fostering a level of curiosity with a significant other or a child of what really is stimulating to them from a cerebral level, that it's something that they tend to lean into and be more inquisitive about that, and kind of encourage them to dig deeper and learn more about that topic and those things, and just help them learn to learn more of the things that really inspire them or make them happy or just bring general joy to their lives. I think it's what probably a lot of different types of schooling methods where they favor towards their strengths, or, there's so many different philosophies on that, but I think there's a really unique opportunity too to help them learn things that maybe the school curriculum's not going to, teach them.
Yeah, you could always add more, right? Or you could add a depth that isn't there. One of the other super exciting things that I think might come out of this is this whole academic structure that we have doesn't need to be in this rigid academic structure, right? So if we are now creating course loads and you're delivering them per ability level or whatever your academic level is, it doesn't make sense for then they'll kind of do it now where, say your kid is at what level in math, and may go to another classroom for that in elementary school, and then they come back for a reading or whatever. But it really seems to make sense, again, if we're doing this sort of dedicated platform where we can decentralize education now, that kids could be learning whatever. So
Right.
There's no reason that they're restrained to a third grade reading program if they're in third grade. Instead, maybe if they're reading at a 7th or 8th or 9th grade, why aren't they being able to, they should be able to take classes at that level. So now we have this, instead of this one size fits all, and then we have little teeny lightware breakouts, instead it becomes a truly individualized healthcare system. Not healthcare system, educational system.
There are some similarities.
Yeah, and there actually are quite a few similarities
Yeah.
between big education and big healthcare. But we can start actually seeing personalized education. Like we always say that personalized health, right? We have personalized education where the kids go in, they're assessed, and they find out what their strengths, what their weaknesses are, and then they're put in the appropriate levels. And then if one accelerates, they keep going that way. And if they're, it could be really, really, really cool. As things go on.
I think, sorry.
No. You had something.
No, there was something about just this idea of even the older ones seeing these younger people getting it. Like, to me, it's kind of like it's a self-fulfilling thing where it helps and like kind of makes them not want to be if this kid that's 3 years younger than me can get it, I'm really slacking. Like, as long as that environment culturally is embraced and there's no bullying of that kind of, any negativity about that, I think it helps everyone else learn, and I don't know, it ups the level.
It ups the level instead of lowering the level. Like what a lot of, I think, again, I'm the physician, obviously I'm not an educator. I do a lot of education, and so I'm interested in that, but I obviously don't have the academic background there. But it seems like a lot of the focus in healthcare has been to date of having a minimal level of expectations that they're trying to get everybody to, rather than having a high level of expectation for every individual student. Yeah. And that's a very different focus, because when you're devising, and a lot of this has to do with the testing, and we don't have to talk about that, but everybody has to pass this minimal standard. Well, the problem is, if that's a minimal standard that you're working for, there's no desire to really exceed it so much. And the people who are already working hard get bored. Well, if you have a general higher level of expectations, people tend to, behaviors tend to stretch towards high expectations, or they'll diminish when there's low expectations. And if you're running around, but I guess from, again, this is sort of getting off topic, but in our healthcare, in our education, not our healthcare system, in our education system, they would do all this stuff like makeup days and blah, blah, blah. So there's really no consequences, because kids knew that the to-do date wasn't the to-do date. They did all this stuff, again, with the intention of trying to make sure everybody met this minimal level of activity. Well, that's what you're going to get. And I'm sitting here going, if the due date is this, then we should expect that the due date is that. And then if someone fails, then lo and behold, well, they need to learn that we have a high level of expectation for you. Right. It's just my daughter had in elementary school, she had a teacher who came in, he had been a middle school teacher. And it was amazing because he came in with a middle school mindset, right? And so his thing wasn't, now I'm in elementary school, and so I have to teach less. Instead, he saw his students as, this is what I think you can do. And it was remarkable how that class just outshone the rest of the school.
Yes.
And, granted, he's a great teacher, but I also think it has a lot to do with expectations. When you start looking at this data, again, setting expectations or what teachers expect from their students, that changes the game on how education is delivered to them. So there was studies with the word that they used, they called it the Pygmalion effect, where they basically went in and told teachers that they took a random percentage of the class, like random 20% of the class, and they said that in one class they said these were all the extra bright kids, and in another class they said this 20% was, these are the slow kids, right?
Yeah.
And it was just total bogus. I mean, it wasn't actually based on anything. They just told us teachers. And what they found at the end of the school year was when teachers thought that these particular kids were gifted or whatever, those kids' scores went up.
Yeah.
And they think it was through how they interacted and the nonverbal communication. In the same way, in a dangerous way, if they were telling these teachers that these were the not gifted kids, those kids dropped. And so I guess bringing that back to the kind of the discussion of what's going to happen in the future is, if you're in this non-structured environment where kids can now be matched to their academic ability and raised from there, that changes the game when it comes to expectations. Again, so they're not, for kids that are accelerating in one area, they're not being held back because they have minimal expectations. And from other kids that maybe are struggling in an area, there's still at least an expectation for them to attain. And it becomes not like this is the minimal level for everybody. This is the level I'm trying to get. So it becomes much more individualized. So that can be quite exciting, but we will see, because education is a big behemoth, just like healthcare systems. It doesn't want to change very fast. Or
it can be like turning a tank around, going back uphill. I mean, there's so many moving parts to these massive infrastructures that are resistant to change for the most part. But I think there's what you're saying about children, or anybody for that matter, when you act as if this person before you is gifted, or is that you show belief. Basically, you show belief without even saying the words. Of course, words are important, but not necessarily saying it directly that I believe in you, but all your actions, behaviors are in support of that, and you give them all that they need to, whatever it is that they need to accomplish, and you support them. I think people start believing in themselves and they want to rise to the occasion, just like in this pandemic, how sometimes people may not be doing as much or may not feel like they have a purpose or a mission or a meaning, and in the moment someone gives them a reason, or all eyes are on them, or it just feels like there's purpose there, people step up and they will be way more than they've been in the past. And that's the beauty of this kind of situation, despite the fact that there are some negative aspects to any type of massive challenge for this world.
Well, and I think we may have talked about this on the last episode. I can't really remember anymore. But the other part about what's occurring right now with the pandemic is the system, which was already under strain before this happened. I hope everybody realizes the healthcare system was in not great shape before we entered into this pandemic, and now it's like under critical stress. So when we talk in, who knows, a couple of weeks from now, we'll see even further cracks. But it's going to reinforce this need of self-care, like real effective and what you can do, because we have a lot of what we have been telling, or more importantly, not telling patients about what is effective for them, is going to be really, really key for in the future, because it's going to be less expensive, and lo and behold, it's actually have better outcomes, and it's going to have positive side effects on other chronic conditions. So we're going to return. We're going to have a different level of expectation for people, and it's going to, because that expectation is going to, the cost of that expectation is going to be, people are going to be more willing to pay the cost of that expectation. And what I mean by that is, in the past, for me to sit down and discuss and talk about effective behavioral and lifestyle interventions, that was a very expensive process for me. It cost me to do that, rather than to walk in the room and schedule it for the epidural. It took me 5 minutes. But in the future, when we start, that's going to change the dynamic there, because the epidural, which may provide a short little burst for a number of different reasons, the least of which is the actual injection itself, that expensive procedure now is a cost. While if we can go in there and get people to be engaged in their health again and start developing these self-care, these empowering tools, I think there's going to be a lot more focus on that as well. That's, again, one of the potential gains out of this is, while the healthcare system gets shocked, we're going to see all of that pork and fat and garbage, that all the low value care that sucked up so much money. I do think a lot of it is going to disappear, because there's not going to be any pork to fund it anymore. I mean, we're going to be lucky if we come through this with a functioning healthcare system. Like, personally, healthcare in its current shape and form is not going to survive this. It simply can't, based on just how it's set up in the current expense. We're not going to have another $3 trillion to dump into the healthcare system after this first stimulus. Like, I'm not sure where we're going to get the $3 trillion for this stimulus, but
yeah. Well, man, so much loaded into that. Just to unpack a little bit of it, I would say that I feel like, with much of what I've been learning about how people learn, first of all, we've got to listen to patients. And secondly, much of what they start, in order to shift beliefs in how people view pain and how to address it, a lot of times there has to be an experiential process, meaning there has to be an experience that you go through where something does change and you start believing it, that it actually can be better, make it better or worse. I mean, that's part of the learning process, is what helps my pain, what doesn't help my pain, and whatnot. But I feel like, and I just talked about this in an early interview today, is that I feel like this delayed time period where people can't get all these elective cases, such as back fusions or knee scopes and some of these things that are very questionable for
beyond
most
when the placebo
most
studies demonstrate that they're not superior to placebo. Let's not sugarcoat this.
Well, well, I'll say that there is a very rare case, not the daily use of them for what we're doing. Fusions, for the most part, unless you're in a trauma and things have been totally thrown off kilter and the spine is in the right side of your body or something.
So in that situation, you're doing the spine fusion for the traumatic displacement, right? Yes. Not pain.
Not for pain.
Not for pain.
Right. It's to protect the nerves and all the things that could go awry. Or, in very rare cases of, some cancer ate away all the bones that's going to, make you unstable. And
so then the surgery is for the cancer, right? And that's like the key
right
thing to really emphasize, is that the actual procedure is not for the pain per se.
Fusion's not meant to treat pain.
No.
It's for something truly needed structurally.
That's for a structural deficit.
And then there can be people that push that into the gray area and try to convince you that you are unstable when you're not.
Yeah.
But we could go on another, that's for sure. But the cool thing about this is that if there is a silver lining in this delayed ability to get elective cases, is that there are going to be, and I would probably put $1 million that I don't have on it, that I can guarantee you there will be a percentage, don't know what that percentage is, that a percentage of people that may have had on the books a surgery that can't get it for like 3 or 4 months, they might find, which some of them will, that their pain has changed or has completely gone away by the mere nature of time. And I think the pandemic is going to affect the paindemic, as I always talk about, is that there might be a belief shift in this sense that my body is actually pretty amazing and it can change and it can heal itself and pain can change. And even though my pain was real, it had changed, and what I thought I needed, I might not need. And especially because financially, people are going to be in a different predicament. So even if they could get the elective surgery, financially, they may not be in a position. So they may go months and months where they can't even get the surgery they thought they needed, and then they end up being better from a pain perspective. And that's where I think that silver lining is for some people to start recognizing that their bodies are capable a lot more. Thoughts?
No, I would agree with that. I think it would be a little bit more effective the more we could get that information and awareness out as well.
Messaging, yeah.
Because on the other side of that is you're going to have people that are, if you have a negative mindset to it, meaning you're seeing this through this kind of this takeaway unpleasant lens, and that we can actually heighten the trauma, right? Because then they're saying, I really need this. They told me my spine's disintegrating. I can't get it. I can't get it. It's only going to get worse. And then becomes the self-fulfilling prophecy as it gets worse over time. And then they may have become even more moribund and maybe even more inactive and had a host of other things. And then they end up getting the surgery 6 or 8 months down the line. And then they're even worse off than they were before. I mean, I'm not saying they should have had the surgery. I just think that we need to, in addition to it, there's a subpopulation that still needs that message. But I'm with you 100% because you've seen it, right?
I've seen it.
Delayed it for whatever host of reason, and they didn't have the surgery. And in this day and age, what I've also seen is people getting better who were, scheduled for a surgery, but because they book out the schedules and so far advanced, they're actually getting better up to the day of the surgery, but they do the surgery anyway.
Yes.
Or
so crazy.
Well, and the worst story I ever had was, someone who couldn't get, for all the wrong reasons, saw the back surgery, or the back surgeon was improving by the time they saw the back surgeon, was walking 3 miles every day. And the spine surgeon walked in the room without even touching them, looking at them, saying anything, like actually asking them about their pain, and said, "Oh, you need a 2-level fusion based on the imaging." And they had it. And then they ended up getting stuck on opioids and had to go through inpatient detoxification. But they were improving before they even saw the surgeon, right? And so that's what you're kind of talking about. If they're improving, they may never even get in to see the surgeon for these non-essential procedures. And then, God, I would hope they just don't, they're just like, "Oh, I'm doing fine. I'm not going to go in and see these people." I was going to say quacks, but I'm going to see these people.
Yeah. I mean, that's the thing. I mean, if the only reason someone's getting a surgery is because of pain and the pain goes away, you have to ask yourself, why the hell am I putting myself through this when I'm functioning just fine? Like there are little nuances there that maybe there's something else. If it's a cancer or something else, it's going to progressively, get worse possibly. But other than that, I mean, it doesn't make any logical sense. If I only went to see someone for a possible surgery and it was because of pain and I don't have any neurological deficits, I get better and then I decide to do the surgery anyway, like that makes no logical sense to me.
Well, there was I think I used this with Dave Hanscom once when we were talking, and I was like, if you have a broken heart, right, a traumatic breakup, and you were absolutely devastated, and that can be a long time if you've gone through a really traumatic breakup. It could be sometimes years in duration.
Yeah.
But no one's going to walk up to you and say, "You know what, let's do a heart transplant," because we know you're still hurting in that heart. Granted, you are under some significant trauma with that, but a heart transplant is not going to address that in any way, shape, or form. And it would be criminal to do it. And yet when it comes to pain, we do that all the time.
Right.
Where, this construct, and then we tell people we're going to somehow cut it out of them without recognizing those other key contributors that are involved with that.
Right.
Yeah. Anyway.
It's like how in God's green earth can you, if the pain was solely related to the surgery, the need for surgery, how is it that your pain can get better without the surgery? That's the question you should ask.
Yep.
That means there's way more involved than the fact that you have a deficit of a surgery.
Yep.
Anyway, I had to get a little emphatic there.
Well, and
I went Kevin on. I went Dr. Kevin on y'all.
Usually I'm the ranter, much more calm and collected than me.
Well, it's the energy you just saw was what I had pent up for years, which made me write a book. Otherwise, that book would have never been written. You have to have a little bit of rant inside of you to actually go through with it.
Well, you have to have a little rant. If you're doing what we do for pain, meaning purposely not making, quite literally, folks, hundreds of thousands, if not millions of dollars, you're doing it because you care. The only way that happens because of passion and a desire to do the right thing, because you will be, you basically are punished. In the old days, you're punished for doing the right thing. The new days may change, right? Because when in the future, this may significantly change. You're going to want people that can understand pain. You're going to want people that can support you through acute and chronic episodes, who can help you to get better so that you can get back to living, functioning, and working with your families again, rather than getting worse. And do it in such a way that is not requiring you to come in every 2 months or 3 months or every 6 weeks or multiple refills and getting P tested every whatever, and having all these rigid guidelines that are really keeping you out of your life again, but instead can help you to get better and back to living. I think that's going to be key in the future. I do. So
yeah,
it'll be good for you.
You would?
It'll be good for you in the future.
Yeah. Well, I think this is probably a good place to finish off, and I think there's going to be more things coming in the coming weeks for us to chat about too, that relate not just to COVID-19, but our various topics that we cover on Paindora Podcast, because man, they all somehow they interlink and interweave with our lives, and we're all human. We're not robots. We actually have a pretty complex being that I think we can all relate to in some way or another. And so I want to thank you, Dr. Kevin, for joining me today and reaching back out to our audience.
As I'm disappearing here, I just noticed my own video. I'm like, wow, I'm like disappearing like a ghost again.
He is ghost-like. Everybody.
It's my Zen spirit as I meditate here on my lake. So everybody out there, thank you so much for listening. If you have any questions, let us know. Please put them either in the comments, or you can email me directly at drkevin@straightshothealth.com. I think, what's your email?
What's my email?
Yeah.
Dr as in doctor at challengedoctor.com.
Doctor at Challenge Doctor.
It is, but you have to spell it Challenge Doctor. So, maybe
doctor too?
You what?
You have to spell the doctor at Challenge Doctor?
Dr at challengedoctor.com.
Oh, just the Dr at Challenge
Doctor. Just Dr. Yeah.
Okay.
Maybe I should make something easier, but
You should make something easier. Because that gets confusing, because then you're like, well, actually, is it Dr and is it Challenge Dr?
I know. I should put something like connect at challengedoctor.com or something like that.
But that's very unpersonable.
It is impersonal.
Yeah.
What should I use? Maybe we can take a poll.
Cady at challengedoctor.com.
But then do you spell it Dr. Cady, or do you put just Dr?
Cady's easy. Cady.
Yeah. So just put the last name, Cady at challengedoctor.com.
You could. But then you want to make sure that you have the doctor in front of it, just to.
But then they try to spell out doctor. See, I'm telling you, it's not as easy.
I don't seem to have any problems, and mine's Dr. Kevin at.
Well,
I don't have doctor in the thing. It's Straight Shot Health, not Straight Shot Doctor or something. But
maybe I'll think about that. Maybe I'll do Dr. Cady at challengedoctor.com.
Dr. Cady at challengedoctor.com. I think that works well. What do you guys think?
Okay.
Folks, everybody agrees with me, right?
Well, I'll put it. If you just go to challengedoctor.com, you can always connect with me. How about that? Challengedoctor.com. Find me there.
Perfect. All right, everybody, stay safe and socially distant until next time. Dr. Kevin, Dr. Melissa Cady, and we'll talk to you soon.
Stay healthy. Bye-bye.